So the bloating, distended feeling that you have, was it associated with food or eating at all?
When I would eat, I would be hungry, but when I ate, I could only eat a couple bites, and then right after I ate, I would start to feel very nauseous. So that's something that was a trigger for me, but I didn't see it as a big problem. I just thought my appetite was changing. I was working out more, so I thought they were normal changes. But for my family, they noticed I wasn't finishing my food.
Okay.
Yeah.
And when you were having these symptoms, did you go to a healthcare provider?
I did. I went to a healthcare provider. At first, they thought it may be, kidney infection or something like that. And I also went to a physical therapist who manipulated my side, thinking it was muscular too. Both times I was there, I got very sick while it was happening. And my primary care provider did decide to run some tests, and one of that was an ultrasound. And so that's where they found my cyst.
Okay.
I actually did have pain, and I also had a lot of nausea. So the feeling that, it wasn't every day, but it was enough where, because I was journaling, that I noticed that I was having a lot of symptoms. So for an example, if after I ate, normally within like an hour, 45 minutes, I would start to feel nauseous.
So I had two eating issues. One is, for several months before my diagnosis, I would be nauseous once every other week or so for absolutely no reason, like just periodically. And then I also, about 10 days before my surgery, experienced the early satiety. And for me, that was like novel, because I'm one of those people that if I get anxious, my go-to is to eat a lot. And I've only once or twice in my life been anxious enough that I have actually eaten less. But this was different from either of those. I had 9 sweet potato cubes, and I felt like I had eaten Thanksgiving dinner. I could not